Hi, I'm Frances Blackmore. I'm a salaried GP at the Caversham practice. We're based in Kentish Town in London. I think it's almost quite hard to put into words, but the type of discussion, and this I should say that I acted as facilitator, and our practice nurses acted as the clinician. Me, the facilitator, because I'm the one that's done most of the training, but that I led them through it, and they answered the questions. So it was very interesting to see the discussions that went on and how broad-ranging they were, but how practical they were, specifically about diabetes and sharing really nitty-gritty stuff about diet. But the way people supported each other and interacted with each other, not that, well, we sort of were hoping and expecting that, but more a couple of catchphrases like, I'm really glad you asked that question. I was not thinking of asking that, but I've never really understood it. Those sort of things you're hopeful from a group. And I think also perhaps not necessarily the people that our nurses were expecting to attend, but did and have engaged through this process. There's something about it is different to a normal consultation that has invited people to think about their illness a bit more. The diabetes group, I think, were people that aren't used to using video platforms and don't use IT with work, but yet came to it very open and really, I think, welcomed the discussion in the time that this was now a month ago, so where things really still were quite shut. The asthma group had two much younger patients in who were very tech savvy and had been doing Zoom all day with work or MS Teams. And so they came to it in a different way. It became more, it felt like a sort of, there was more clinical content in a way rather than the sharing of experiences, I think. But they on the day had certainly said that they really appreciated it and thought it was very useful. We've had two people say they want to come back again, one because he has both asthma and diabetes, so he wants to switch to the other group, and the other just to attend another group. So I think that says a lot.